After surgery, blood or body fluid may collect at the surgical site and slow the healing process and cause discomfort and soakage of dressing. Closed suction drain avoids the collection, fastens the wound healing, and decrease wound related complications. This is how I keep the Romovac suction drain just below the skin in subcutaneous plane. Tube has multiple small holes to suck the fluid, and these two black marks on the tube should be at or just inside the skin. This is a clamp used to block the tubing before emptying the chamber. One should wash their hands with soap or wear sterile gloves before emptying the box to avoid infection. To open the chamber, do not unthread the white cap as it may not fit well on refixing and leak. Green connector is easy to remove and refix. Pull out the green connector and empty the chamber into a separate cup or measuring jar. Though measurements are marked on chamber, most often it's difficult to assess accurate volume. It's important to daily record in a chart about 24 hours drain output volume, as drain will be removed once the 24-hour output is less than 10 to 15 ml. You may have to shake the chamber and press it to empty it. If you get foul smell, better to wash the chamber with soap water or change the chamber. Fluid collected can be discarded by flushing it down the toilet. After emptying, it's important to compress the chamber completely to create vacuum, which will act as a suction to suck the fluid accumulated in the surgical site. Then gently reconnect the green tubing to chamber. To unclamp, do not pull it, just push it to unlock from the notch and open the tubing. It is important not to forget to unclamp once the drain tube is reconnected. Avoid taking bath or do not wet the dressing around the drain site to prevent infection. Take a sponge bath until drain is removed. Use the plastic tag to hang the chamber to your clothing to make your walking more comfortable. Do not be worried about discharging home with the drain. You can take good care of drain for better wound healing. You can carry it in a bag like this so that it is not obviously visible to others. You do not have to hold it in the hand and be comfortable to move around. See the different ways to carry it in this video. This shows how to carry the drain with elan. You should reach out to us in following situations. First one, clot in catheter blocking the drain. Usually our team doctor or nursing staff will declot the drain in sterile way. You do not do this at home. Second reason to reach out to us is foul smelling fluid or chamber, fever more than 100 degrees, or sudden bright red blood in the drain, or drain output is more than 250 ml per day. Please reach out to our team. This is how we will be declotting the drain and cleaning it when you reach out to us. The third reason to reach out to us is soakage of dressing around the catheter exit site. The fourth reason being chamber is not holding the vacuum and expanding immediately, indicating air leakage. Either the cap at connecting junction is open or catheter holes are pulled out. These two black markings on the catheter should not be visible. If they are visible and far away from the skin, indicates catheter has come out, and sometimes catheter may come out completely by inadvertent pulling or pushing. Chamber may not hold with clamp on, indicating a hole or leakage at chamber itself. The fifth reason to reach out is swelling at wound site or increasing pain or sudden dropout in the output, indicating a block. Thank you.